Hello, everyone. I'm Ned Kalange. I'd like to welcome you to the third meeting of the Committee on PFAS Testing and Health Outcomes. This meeting today has objectives of hearing presentations, discussions, and public comments by Middle U.S. community members impacted by PFAS. To learn how the National Academy's consensus study guidance on PFAS testing and health outcomes might be useful to these impacted community members, and to provide a forum for committee members to ask questions about community impact and speaker experiences. This is what we hope to attain today, and because it is the National Academy's meeting and open session, I need to start with a disclaimer, and if it sounds like I'm reading it, it's because I'm reading it. As chair of the Committee on Guidance on PFAS Testing and Health Outcomes, I would like to welcome everyone to our second town hall, the committee's third meeting. I want to note this is an open, on the record information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions, and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. For those of you not familiar with the committee process, this is the third of several planned public committee meetings. In the public sessions, we'll have the opportunity to hear from many experts in the field and receive public testimony. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the National Research Council before it is considered an NRC report. The expected report release is spring of 2022. Further information on the study, including future meetings, can be found on the project website at https://www.nationalacademies.org/our-work/guidance -on-PFAS-testing-and-health-outcomes. It's easier to go to the National Academy website and search on PFAS. I'm telling you that experientially. The committee is being asked to provide advice for clinicians about PFAS testing and how test results should inform clinical care. Additionally, our expert committee will examine the health outcomes associated with PFAS exposure and will develop principles clinicians can use to advise patients on exposure reduction. The town hall today provides an opportunity for the committee to hear from Middle U.S. community members impacted by PFAS. We also want to take this opportunity to learn more about the National Academy's consensus study guidance on PFAS testing and health outcomes and how that would be useful to those impacted communities. During the panel discussions, the moderator and committee will ask questions of the speakers. If you're viewing on the web, you may send any comments to Liz Boyle at eboyle, that's E-B-O-Y-L-E, @nas.edu. This meeting is being recorded. Available speaker presentations will be posted to the project website soon after the meeting. I'm going to start with asking the committee to briefly introduce themselves with just their name and affiliation in the interest of time. And I will start. My name is Ned Kalange. I'm with the Colorado Trust and faculty member at the University of Colorado School of Public Health and School of Medicine. Laura?
Hi, Laura Anderco, Georgetown University, and co-director of the Pediatric Environmental Health Specialty Unit, serving Region 3. Thanks.
Thanks, Laura. Erin?
Erin Bell, University at Albany, School of Public Health.
Next, I have Dana.
Dana Barr, professor at Rollins School of Public Health at Emory University.
Thanks, Dana. Kevin?
I'm Kevin Elliott, a professor at Michigan State University and a member of the Center for PFAS Research there.
Next, I have Melissa.
Hi, I'm Melissa Gonzalez. I'm a professor at the University of New Mexico School of Medicine.
And I think we did Erin Bell. So Erin Haynes.
Hello, I'm Erin Haynes. I'm professor and chair of epidemiology and environmental health at the University of Kentucky and deputy director of our environmental health center.
Thanks, Erin. Jane.
Hi, I'm Jane Hoppin. I'm a professor at North Carolina State University and deputy director of our environmental health center.
And Tamara.
Hi, I'm Tamara James Todd, Harvard Chan School of Public Health.
Alex.
Hi, Alex Kemper, Nationwide Children's Hospital and The Ohio State University.
Brian.
Hello, my name is Brian Lind, and I'm an occupational and environmental medicine physician from Yale School of Medicine in New Haven, Connecticut.
Mark.
I'm Mark Werner. I'm a professor at the University of Montreal School of Public Health.
Veronica.
I'm Veronica Vieira. I'm a professor and chair of the Department of Environmental and Occupational Health at the University of California at Irvine.
Thanks, Veronica. Shaban.
Hi, my name is Xiaobing Wang. I'm a pediatrician and a professor at the Johns Hopkins School of Public Health and School of Medicine, and I also direct the Center on Early Life Origins of Disease.
Thanks, Shaban. Chris.
Hi, my name is Chris Wyatt. I'm recently retired from the Caring for Colorado Foundation, and prior to that, the Tri-County Health Department serving metropolitan and part of rural Colorado.
Thanks, Chris. That is all of our committee members. So I am going to ask the National Academy staff to briefly introduce themselves, starting with Elizabeth.
Hi, I'm Elizabeth Boyle, and I'm a senior program officer at the National Academies, and I'm the director of this study.
Rose.
Rose Martinez, I direct the Board on Population Health and Public Health Practice.
Cliff.
Hello, I'm Cliff Duke. I'm director of the Academy's Board on Environmental Studies and Toxicology.
Marilee.
Hi, I'm Marilee Shelton Davenport. I'm a senior program officer with the Board on Environmental Studies and Toxicology.
Kaylee.
Hi, I'm Kaylee Bynes. I'm an associate program officer with the Board on Environmental Studies and Toxicology.
And Alexandra.
Hi, I'm Alexandra McKay, and I'm a senior program assistant with the Board on Population Health and Public Health Practices.
Did I miss anybody? Fantastic. So I want to talk just a little bit about the format of the meeting. We're going to have 3 moderated panels. The speakers on each panel will talk for 10 minutes, and then we'll have a discussion. During the discussion, community members can ask questions using the raise hand function. We will close after the 3 panels with public comments. And as we stated, a recording of this meeting will be posted.